Welcome back to the Urology Care Podcast. Today, our guest is Dr. Brian Stork, an assistant clinical professor in urology with the University of Michigan. He's based in Muskegon, Michigan, and we're going to be discussing what to know specifically about visiting a urologist during COVID-19. Dr. Stork, welcome back, and thank you for joining us for this very important and timely discussion.
Thanks, Casey. I love the show, and thank you for having me back.
So let's just start out with the absolute basics. What are the COVID-19 risks a patient faces when entering a urologist's office?
That's a great question. I think the answer to that question has evolved over time, particularly as our knowledge of the virus and the pattern in which it's spreading has continued to evolve. I can tell you that early on here in Michigan and in West Michigan, we were very concerned about bringing patients into the office, that we transitioned the vast majority of our office visits to telemedicine. More recently, however, I think we've gained a significantly better understanding of how the virus spreads. And as a result, we've been able to transition a lot of patients back into the office with a number of protective interventions. So, for example, everyone who comes into our office will be asked to wear a mask. In the waiting room, there'll be a 6-foot social distance requirement. Our front staff, when they check you in, will be wiping down the surfaces that you touch after you touch them. And similarly, as patients enter and leave the room, we're wiping down surfaces. All of our staff is wearing masks. So my impression and understanding now is that the risks of acquiring COVID from an office visit would be very, very low. And in my own opinion, I think it's lower than what you would expect in the community situation, given all of these preventative interventions that we've put in place.
How are urology practices taking steps to lower COVID-19 risks for patients?
Well, as I mentioned, we're really, from start to finish of the office visit, changing our process. We're offering patients telehealth visits to give them the opportunity to not have to come to the office at all. We're asking family and loved ones who we would normally invite into the office for a patient visit to wait in the car and stay out of the waiting room so that we can maintain proper social distancing in the waiting room. We're on an every 8-hour basis, really wiping down all surfaces in the office and then wiping down surfaces that patients touch when they come in and during their office visit. And we're being very strict with our mask requirements.
Can a patient safely delay a urology visit during COVID-19?
That's going to depend on what the underlying urologic problem is. There's been a lot of concern amongst urologists, particularly with cancer patients, about delaying office visits. At the same time, there's also concern that patients with cancer might be at higher risk of developing COVID. I think whenever possible, for patients who are being treated for a urologic condition, a telehealth visit is probably the way to go when it's available. In general, with the advent of telehealth, it's given everybody a lot more ability to see patients and get them in a timely fashion. So I think I can speak for most urologists around the country where we're doing everything we can not to put patients in a situation where their care needs to be delayed.
How would a urology patient know if their appointment can be done as a telehealth visit?
That's a great and timely question. I should start by saying that not all urology offices across the country are currently set up to do telehealth visits. That's rapidly changing with the advent of a number of platforms that urologists can now use to do those visits. But again, not every office is set up to do it. In addition, not every patient is set up to be able to do a telehealth visit in the sense that they may not have internet access, they may not have a mobile device, or they may have some personal restraints that inhibit their ability to do the visit. All of that being said, I think the vast majority of patients that we see physically in the office can actually be seen via a telehealth visit. Really, the only reason that we would need to see a patient in the office during the pandemic would be for management of a catheter or for a procedure or for an office visit where we need to do a physical exam. And there may be some other similar reasons as well. But I would estimate that about 80% of patients that I would normally see in the office, just for their own safety, I can see via a telehealth visit.
How can a urology patient best prep for a telehealth visit during COVID-19?
The technology is changing. There are a number of platforms that physicians and medical practices are using for telehealth visits. Some of these platforms actually allow you to do a test visit before your actual telehealth visit. As we like to say in medicine, luck is where preparation meets opportunity. And so when physicians and patients both prepare for their telehealth visits, the chances that that visit are going to go well are increased dramatically. Patients can get information from their providers about which platform they prefer to use for the telehealth visit. They can prepare for the telehealth visit in many ways, like they would prepare for a regular office visit, by knowing their medications, by jotting down any changes in their symptoms that maybe they've had since their last office visit. I think it's a good idea for patients to log on to their telehealth visits early so that they don't wait to the last minute and perhaps have a technical issue at the last second. I think it's also important for patients to remember that physicians have a telehealth schedule, and that just like sometimes they run behind in the office, it's possible that they may run behind in their telehealth visit schedule as well. And as always, we appreciate patients being patient and understanding in those situations.
Thanks, Dr. Stork, for all that important information. And of course, we care about your safety as well. So do you just want to tell us about how you and other healthcare providers in your position are taking steps to make sure they stay safe during this uncertain time?
I think we have put a lot of thought into the safety of our coworkers and ourselves. I think we've been a lot better about self-policing ourselves with respect to wearing masks, with respect to hand hygiene. We're now wearing more protective face coverings in the hospital than we ever have before. There's been a lot of controversy about wearing masks and some of these preventative measures, but I see them as a sign of respect. I see wearing a mask and doing these things as showing that I respect my patients and my coworkers. And I hope if people think about these things in that kind of mindset, and maybe not so much of a political mindset, that we can move forward in this pandemic and take great care of each other.
Dr. Brian Stork is an assistant clinical professor in urology with the University of Michigan. He's based in Muskegon, Michigan. Thank you, Dr. Stork, for joining us on the podcast yet again, this time discussing how patients can protect themselves at a urology visit during COVID-19.
Thank you, Casey.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.